Hello, in this video let's look at this book, Pharmacological Classification of Drugs with Doses and Preparations, K.D. Tripathi, 7th edition. In this video we'll be looking at the usage of this book. Last time we looked at the unboxing of this book, a new book, but in this, what exactly how should you use this book? Okay. So guys, this book you should buy as soon as it is released in the market, okay, or as soon as you join MBBS. And every time this latest edition comes, buy it and mark everything that you prescribe or you have seen being prescribed in your hospital, so that you will be able to start your own clinic and prescribe drugs. Okay, so a lot of color paper has been added here, which was not given by these textbook people. See, pink is for skin actually. This is added by me. Pink means for skin. All skin, what and all, if they come with skin issues, what and all do we prescribe, right? Like that, a lot of information has been added to this book by us. Let's look at it. So this book gives you all the drugs, right? Analgesics, cough drugs, diabetes, how to treat, hypothyroidism, hyperthyroidism, steroids, calcium deficiency, how will you treat, hypertension, angina, hypolipidemic, if they have high cholesterol, how will you treat, diarrhea, how will you treat, right, vomiting, how will you treat, peptic ulcer, how will you treat, etc. So basically this book is trying to give you all the classification of drugs, right? So it is very easy access for you, and as it is a very pocket sized book, you should be carrying it in your doctor's coat. So apart from this, a lot of things have been added here by me. Eye drops, ear drops that they prescribe, multivitamins that are prescribed in our hospital, calcium and probiotics that are prescribed, for mouth ulcer, what treatment, common conditions, what treatment also. So as much possible has been fit into this book. Okay, so let us look at how it is being used. So orange color paper stuck here by me for pain. Okay, orange means pain. So here you will see all the NSAIDs. Don't give NSAID if kidney issue is there, and all the important drugs here that are prescribed very commonly. Nimesulide 100 means 100 mg, diclofenac 50, aceclofenac 100, etoric oxide 90, is it? Okay, paracetamol 325, 500, 650, and the common names are like Tylenol, Crocin, Dolo, you know all those names, right? Then ibuprofen you will give 400, naproxen 500, then mefenamic acid 250 is written here, pyroxicam 20. What else have you seen being prescribed? Please mark it here. Okay, and any extra information that you want, you can stick here, like for stomach pain, hyoscine, period pain, meftal spas, menorrhagia, right? So some things you can write, we have written. Okay, so this book also gives you the common brand names, like aspirin comes as Disprin, right? What is the mg, the dose that you have to prescribe, all that is there here. So similarly for gout, what drugs are prescribed by us, and what is the diet that you have to give for gout. So that chart is stuck here by us, right? Then for fever, cough, cold, all that common drugs written here. For cough, what and all do you give? So the drugs that are given for cough, usually cough syrups, Astakind, Brucid syrup, etc. is written here. But here in the classification marked, what do those cough syrups contain? They can contain bromhexine, ambroxol, guaifenesin, acetylcysteine. They can have terbutaline. They can have salbutamol, that is, and then they can have dextromethorphan. Then they can have chlorpheniramine. So all those things which are contained in those cough syrups, etc., marked here. Okay. Okay, this is sugar's color, right? Gray. So people who have diabetes, right? They should wear shoes, socks. They should not, you understood, right? So that they don't hurt themselves. They should follow a diabetic diet. Oral anti-diabetic drugs. What and all have you prescribed? People, metformin, obviously. Pioglitazone, maybe. Voglibose, dapagliflozin, which is very new and very good drug. sitagliptin, teneligliptin, linagliptin, glibenclamide, glipizide, glimepiride. So these are the drugs that are commonly prescribed by our clinic. Okay. So these are the common brand names also given. You are understanding, right? Basically, this is the usage of this book, how we have used it. You also can use similarly if you want. Okay. So let me jump now to just show you some things like red. This red is for blood pressure. So hypertension treatment. Okay. So antihypertensive drugs. What and all have you prescribed so far? So let us look at the first line drug, that will be ACE, ARB, but they mostly give ARB. Telmisartan, right? So then blue is for what? Kidney. For kidney drugs, blue. Okay. Acetazolamide, where will you use? Diuretic, mountain sickness. Okay, even in glaucoma they are saying. The next thing is to mark them like this: safe, unsafe drugs, something like green you can put, or a yellow, right? To highlight them. That is the next step that I am planning for this book. Lipidemic drugs, you can see here. Hypolipidemic drugs, what and all do you give people? Very commonly you give rosuvastatin, atorvastatin, fenofibrate. Okay, these are what are commonly prescribed. But diet as such, diet chart, yes, there you see. For low fat, low cholesterol, what diet should we give? Okay, so that you can advise the patient, and this book is going to guide me for that. I know it is a long video, but we'll try to cover as much as we can. What is this color, guys? This is pink, actually, stomach color, dark pink. This is for peptic ulcer. Okay. For peptic ulcer, what will you give, guys? PPIs. Okay. And what is this color? This is vomit color. Okay. This is a kind of a yellow vomit color. This is for antiemetics. Okay. So what will all you'll give? Metoclopramide, domperidone, ondansetron, right? Main drugs that you should know. Okay. Then this is brown, guys. Brown is for what? We have poop color. So this is for laxatives if they come with constipation. Okay. So it brings me here. It tells me all the drugs and how to handle it. Pink is for skin. Very good. So all the skin things that we usually prescribe for the patients: T-Bact ointment, then BPO gel for pimples, Silverex for burns, then Zolef for fungal, calamine for itching, right? Then Flucort is a steroid, Capsitop ointment if they have pain, right? Muscle pain, then Thrombofleb ointment. So all the skin to usually topical stuff is written here. Okay. I basically need a lot of pages in this book to write a lot of notes. So guys, it's up to you how you want to use the book, right? So this is just one way that we are telling you. So what is there here at the beginning of the book, just made some place for history taking. Very important in history taking. Most of it you will do. So standard things that you have to ask is LMP, period of gestation, are they alcoholic, right? Very important to ask that. Are they taking any other drug? Are they allergic to any conditions? Did they travel recently? And then another thing that I made place here for is the standard tests that we order for people. Okay, so you ask for very standard things that you have to write, I feel, is serum vitamin B12 and serum D3, that is the vitamin D3. Very important, I feel, to test for everybody, especially people who come with weird symptoms, right? Fatigue, some kind of a skin, peripheral neuropathy, etc. So all those tests are written here for a quick glance for me. Okay. Thank you guys. Thank you for watching this video. Bye bye.